Next, we have our Women's Health Tech Initiative Director, Susan Solinsky, and a digital health leader on a number of different startups, but currently co-founder and Chief Growth Officer for Ellipsis Healthcare. Hi, Susan, how are you?
Hi, so glad to be here, Stan. Thank you for including us.
Wonderful to have you. And we'll turn the virtual podium to Susan Solinsky.
Well, thank you. First of all, thank you, HITLAB, for having us and allowing us time in this incredible symposium to focus the next 10 minutes on one of the most incredible women's health CEOs and companies, Gabbi. And before I start, I just want to congratulate Kaitlin. I think those of you that have been following the Women's Health Tech Initiative may have seen her present last June as one of the top 30 innovators in women's health tech. And then in December, she appeared on our stage at our annual challenge, and she not only won the seed stage, but she also won the audience favorite award, which is very difficult. We have a lot of attendees, and we're so proud of her. And so, Kaitlin, I've been privileged enough to hear a little bit about your founding story, and I wondered if you'd share that with the audience today. It's just a remarkable story, and we'd love to hear from you.
Sure, thank you, Susan. You know, it like a lot of founders who venture out to solve a problem, it's from a personal experience. And for me, it starts with my mom. So my mom found a lump in her breast in 2012. And although she was getting annual mammograms, it turns out that wasn't actually the right screening for her. So it took 4 different modalities to find her breast cancer. But at that point, it was too late. And my mom died of delayed diagnosis. And right after she died, I found a lump. And even though I knew how to advocate for myself now, what questions to ask, I still had to fight to get the necessary screening. And it wasn't until I had what was supposed to be a preventative surgery that I was diagnosed with breast cancer in surgery, and I was only 24. And so that just fueled me to go into healthcare. And as I was working now in this space, I realized that what happened to my mom and what happened to me were not all that uncommon. In fact, women everywhere are experiencing delayed diagnosis. And that's really where Gabbi was born.
I feel like every time I hear that story, it gets to my core. I want to thank you so much for what you're doing. You're solving a really big problem. And I wonder if you could tell us a little bit more about what you are solving.
Sure. So the 5-year survival rate for an early stage diagnosis of breast cancer is 99%. And yet, 85% of women who are diagnosed with breast cancer under 50 are diagnosed at late stages. That means that roughly 60,000 young women are dying each year unnecessarily. And the 5-year survival rate for these late stage diagnoses is only 28%. But if we know that 99% is possible, why are all these late stage diagnoses happening? And so that's the problem we're solving. We are on a mission to decrease delayed diagnosis, and we're starting with breast cancer.
I don't know if you can tell, but the chat is lighting up. I want to thank people that are writing up. And for those of you that are watching, please continue to add to the chat. This is such an important problem. And Kaitlin, you and I have spoken. My mother is a 2-time breast cancer survivor. I'm very lucky to have her still. I really, really value what you're doing. How exactly does it work?
Yeah, so for the science and the back end side, we're leveraging all this data about you that already exists. So in your claims or your medical records, and we've been able to create a risk model that can accurately, using that data, predict your 2-year and lifetime risk of breast cancer. Now, from the consumer side, we're harnessing all that and putting that in the hands of women. So via an app, you're able to learn your risk of breast cancer, receive a personalized care plan of what you can do about that risk and how to find a detection early should there be one. And then we help navigate you to care, all within Gabbi.
Well, I know the next question is coming from our audience. So how do we get it? How do we get access to what you're building?
Yes, so 2 ways. we haven't launched yet to the public. So the first way would be go to our website and sign up to be an early user tester. And we would love to extend Gabby to you for free for being an early user. The second is we really see the opportunity in selling to self-funded employers and payers. And so advocate to have Gabby provided to you by your employer, by your insurance company. The more we're able to get in the door, we truly believe that this should not be something that women have to pay for, and help us get your employer to provide it for you.
That's terrific. I love that call to action. And I think along those same lines, we have this incredible HITLAB community. We've been privileged to have you be a part of it. What do you need? What else can the HITLAB community and our audience today do to support your journey?
Yes, so I would say, other than signing up to be a user tester, other than advocating to your employer for Gabby to be a benefit, we are raising our next round of funding. So if you happen to be an investor and interested in participating in this round, we would love to have great partners. And I know, like you said, and I've experienced, the HITLAB community is just phenomenal. So the third would be any investors. And yeah, I think those are the top three things.
Well, thank you. And
oh, actually, I'm going to add one other thing, and we're hiring.
Oh, okay. That's always good. So anyone in the audience that's interested, that's very important. And then as we start to close the session, I spend most of my day thinking about the importance of good mental health and the correlation between mental health and physical health. And in the context of what you're building, can you talk a little bit about how that is important to women's health, and particularly in the breast cancer space?
Totally. In fact, there's a lot more influence and overlap than one would think. And what we're most excited about is when we were testing and training and then validating our risk model, we were in the world's largest claims data set. And there were 4 factors we found that had the greatest impact in predicting a woman's risk. And there were 10 others that were not as high as the other 4, but still significant. And one of those was anxiety and depression disorders. And so I think we still are very much learning how to understand mental health, and there's so much stigma around it, but it was yet another example of how much mental health, mental illness can have an effect on your whole health.
That's exactly my belief as well. And I really appreciate you talking about that. So as you think about what you're going to do as you're building out the company, where are you in 5 years? Like what's it look like at scale?
We aim to become the early detection company, so that every preventable cancer is found that should be a stage 4 is found at stage 2 or earlier. So not just breast cancer, but we are your go-to specialist for all preventable diseases.
Thank you, Kaitlin. Thank you, Stan, for letting us be here. This is just amazing conversation. Thank you.
Thank you,
Thank
Susan.
you both. And again, Susan, thank you for your leadership within the women's health tech community. It's wonderful.